A traumatic brain injury, or TBI, can be life-changing. It can be the result of a bump, blow, or jolt to the head, but there's no standard practice when it comes to caring for patients with a TBI. That may soon change.
The stats are staggering. 3 million Americans are living with a traumatic brain injury. 1 million people will be treated for one this year, and 50,000 people will die.
It's a tough injury because the patients themselves are comatose.
ICU patients are monitored by several machines that give valuable information on a patient's heart rate, blood pressure, and oxygen levels, as well as functions of other organs. Now, neurocritical care doctors at the University of Cincinnati were one of the first to use a single device that collects and compares all that information and more.
This is our component neuromonitoring system, the CNS, and this is a portable device that goes into the hospital room with the patient.
The multimodality neuromonitor tracks vitals, plus gathers information from the patient's brain and tracks that information over days, even weeks.
Because what's happening to the patient on day one is often very different compared to what's happening to that patient on day 3.
Giving doctors a more in-depth view of what's going on inside the brain so they can stop more damage from being done.
We're learning a lot about what those patterns look like, how individual they are, and how we can treat them in a more precise way, tailored to that patient, be able to see what's happening over time.
Dr. Foreman says just as important as telling physician what's happening inside the brain of TBI patients, doctors will have more information on what treatment patients may not need that could be harmful or add stress to the patient.